and looking at the year that is to come. This evening, we've got some really interesting updates from across different parts of the Trust, starting off with our new Chief Executive, Maria O'Brien, and then we're going to be hearing about the finances and about some of the services, and there's also going to be a chance for you to ask any questions that you may have. Please, can I ask, if you're not speaking, to just remain muted for the convenience of all of us. But without further ado, I am going to hand over to Maria. There's actually an etiquette slide, in fact, to guide us on that. If you've got any questions, please send them via the chat. And the meeting is going to be recorded, as you just heard the voice from Zoom say. So without further ado, let me pass over to Maria, who's going to introduce herself and lead that year in review and look ahead. Maria, over to you.
Lovely. Thank you, Tom. Thank you for that introduction, and a very warm welcome to everybody joining. I'm delighted to be here. I'm now in week 4 of the Trust, and it's been a lovely experience. I've visited some great services to date, and I'm still working my way around some others, but I'm really looking forward to and very privileged to be here as your Chief Exec. So as I'm in week 4, I will do part of this presentation alongside Paul Stefanowski, who was the interim chief executive for a few months and has been here for a lot longer than that, and I think Paul can take us through some of those highlights, but I'll start off and do a bit of an overview of where we think we are as a trust. So can we go on to the first slide, please? So if you think about West London and how we deliver services, and we broadly deliver services in 2 particular tranches. So we serve quite a large population that you'll see there, 800,000 residents across those boroughs of Ealing, Hammersmith and Hounslow. And we deliver services both in mental health services and in community health services in those boroughs. And we're really delighted that obviously our Hounslow community services, and we'll be hearing from those a little bit later, have joined the Trust on the 1st of July. And we're really delighted that they're here with us and gives us the opportunity to really think about how we deliver integrated working at a place-based level. And so alongside those core if we can just go back. So alongside those core services, we also deliver specialist forensic services and run our high secure services down at Broadmoor Hospital. So those are really the 2 main chunks of what West London delivers. So if we can move on. And you'll see there that we operate across a lot of different sites, over 80 sites, and that's a positive thing because it tells us that we're working with our local populations and we're delivering care as close to home as possible. And that's what's particularly important about West London. We're a forward-facing, outward-looking, integrated community and mental health services. So that's why we deliver services in so many people's homes, as well as lots of different sites. Turnover pre-Hounslow joining us was just under £500 million, and delighted to say that our CQC rating is good overall, with outstanding for caring in our forensic services. And of course we do have an aspiration to be outstanding, but delighted that we're a strong good. If we move on to the next slide, please. Our staff is our real important asset to us. We can't deliver the fantastic services we deliver without having our staff. And we're delighted that we have got quite a diverse mix of staff that's very reflective of the populations that we serve. And we're also pleased, although we've got lots of work to still do, but we're also very pleased that for staff that come from Black and minority ethnic groups, we've made some really good progress in ensuring that that is representative in our most senior leaders across the organisation. And we've had quite a change. If people want to look at our workforce race equality standard reporting on the website, you'll see that we've had quite an increase from, I think, just over 20% to now over 50% of people from Black and minority ethnic groups that have progressed into more senior roles across the Trust. And that's work that we particularly want to focus on in the year ahead. And our board, you can see there, consists of execs and non-executive members. I obviously joined, as I've said, 4 weeks ago, and Prior to that, Carolyn Reagan was your substantive chief executive, and Carolyn very well thought of and loved across the trust and had been in the NHS for some 40 years. So sincere thanks to Carolyn for all the work that she has done, and indeed to Paul for the 6-7 months or so that he was acting as an interim chief executive. We currently have a new interim chief nurse, and that's Gillian Kelly, and you'll be hearing from Gillian a little bit later. Gillian was the deputy chief nurse and is acting into the interim chief nurse post following Steph Bridges' departure last week. Steph's gone to a big job down in Hampshire, so we're delighted that Gillian has joined the board, and I will be substantively recruiting for that post in the autumn. And also to note that Neil Ragabar, who is covering at the moment for our forensic and high secure services as the Chief Operating Officer, Neil is covering until September. Leanne McGee has taken a short sabbatical, and that's given Neil the opportunity to join the board. So we're grateful to have Neil as part of that. And obviously you've met Tom at the start, and Tom is the chair of both ourselves, CNWL, and also CLCH. And I'll say a little bit about that next, if we can go to our next slide, please. So having Tom as a chair across those three organisations has given us the opportunity to think how those three organisations will work more closely together. And in particular, we want to make sure that we're able to tackle together some of the things that are tricky to do and that individually as an organisation you may well struggle with, but actually together 3 heads are better than 1 head trying to sort some of those problems. So we've got some real ambitions for how we drive excellence across our community health and our mental health services, how we really integrate and deliver at place level. And to support that, the 3 boards will be coming together to meet in common as part of a partnership. And in fact, our new board in common will be meeting for the first time tomorrow. And each of the trusts will be part of 4 different strategic committees that will focus on quality, on finance, on how we transform our services, and on our people as well. So there may be questions about that later. Happy to answer any more, but very much this is about how we can really spread best practice and support improvements across the whole of North West London where we're delivering community and mental health services. And you'll see from this slide that we work with lots of partners, both in the NHS as you'd expect, but lots of partners in our local authority and our voluntary sector organisations. We've got a good relationship with those, and we will continue to hopefully build on that and to have good and long-lasting relationships in the year ahead. And it's an opportunity for me to particularly thank those organisations for the outstanding work they do and the support that they give us as a partnership. And if I could just perhaps end before I pass over to Paul on some of the feedback that we receive from our patients, our service users, our carers. And much of these quotes are actually really positive quotes, and that's great because it's great to have feedback like this because it really motivates our staff and reminds us about how we get things right and what's important when we come to work each day. But we do recognise there are times we don't always get that right. And it's really important that we continue to receive feedback from our service users, our patients, and indeed our staff, because it's only through receiving that we are able to actually change and improve our services. And on the back of feedback, we've rethought, as a couple of examples to share with you, we've rethought how we will do our friends and family test so that we can reach more people, particularly those whose first language isn't English. We've also thought about how we involve service users in some of our training activities, and particularly those in our mental health services. And again, we would continue to welcome feedback from our service users to support some improvements in those areas. And finally, we've also involved service users in terms of developing videos for what to expect when you come into hospital. So particular thanks to those working in the Ealing Care Partnership who have developed something for their intermediate care units. And that's that's based on the feedback that we have received from our patients about things that we could improve. So please continue to get that feedback to us, and that will help us continue to drive improvements. So I think I will pause there, and I'm going to hand across to Paul, who's going to focus on the highlights from last year, and then I'll come back to you for the year ahead. So Paul, shall I hand to you?
Thank you very much, Maria. So my name is Paul Stefanowski. I'm the Chief Finance Officer and Deputy Chief Executive. And can I just say, firstly, how delighted we are that, Maria, you've joined us at West London, and we're absolutely certain you'll do a fantastic job. So welcome to West London. Yes, my point in this segment is really just to look back at some of the things that we've managed to achieve, and this past year has given us many reasons to celebrate. So let's firstly just take a look back in this highlights video.
Hi there, my name is Will Poulter, and I'm an actor. I'm also the ambassador for the youth services here at the Circle. I'm a very, very proud ambassador of this space, a space that looks to provide a safe and welcoming environment for young people who are experiencing mental health issues.
Excellent, thank you. And that's covered quite a number of the initiatives and successes we've had during the year. But I've just put up 6 specific things that that have happened during the year. Just going through them. New community services. So this is about Trust expanding its service offer. So a couple of things like the Hounslow Respiratory Service and a specialist smoke-free service in Ealing for pregnant women and people with mental health difficulties. You will know what happens in 24-25 with Hounslow and the Argyll services, but this is 23-24. We've also had a couple of CQC inspections, 2 focused inspections, which haven't changed our overall rating of good. The Patient Safety Instant Framework, PSERF. So we've now adopted this, which replaces the old serious incident framework. So PSERF will help us better to understand how incidents happen, allowing us to learn and improve so we can offer and provide safer care for our patients. So we've produced a new plan and a policy to go with that. Right care, right person. So in this, we've worked in partnership with the Metropolitan Police to introduce right care, right person. This provides a framework for decision making when the police are involved in responding to incidents involving people with mental health needs. That was introduced in the autumn of last year, and this will ensure people receive right care in the right place, as the name suggests. Collaboratives, that's been mentioned on a couple of occasions, but the 3 trusts, us, CNWR and CLCH, have already established provider collaboratives in community, forensic and mental health services. West London NHS Trust also established a joint sustainability team with CLCH to deliver against our strategic priorities in this area. And by working together and sharing best practice, we are better able to join up care for our communities and improve access to and the quality of our services. And then finally on this slide, just to note that the staff survey, we've had the highest response rate on record for the trust, with over 60% of staff responding. We can always do better, and we always strive to do better. So if we can have the best on record this time next year, would be brilliant. We saw improvements against all of the NHS People Promises themes, and we have the highest ranking in North West London against these. As always, though, we can always improve, and we always value the feedback we get from the staff survey, and we will be doing, and we are completing action plans on the back of this to hopefully improve our staff survey even more in the coming year. The next slide really is honestly just a plug for the quality account, which is always published alongside our annual report and accounts. So every year we set 3 quality priorities. You will see there in 23-24, sharing the learning, reducing restrictive practice, and safe and effective transitions. And then we also identified supplementary themes: quality, diversity and inclusion, safe, caring and responsive, medicine safety, and workforce and staff wellbeing. Once again, you can read the quality account in full on our website. It's always published on our website alongside the annual report and accounts. And then talking about trust as a whole, we've also, on an individual and team level, it's worth pointing out some excellence that we've achieved. And as you will see there, the Nexus short film shortlisted for NHSJ award about eating disorders. So that was co-produced with young people during the pandemic in association with Imperial College London. Trust Learning Disability Nurse Martina Gomez shortlisted for a Nursing Time Award. Trust staff win the North West London Health Equity Award for the refugee programme. So we're the leads on this work in North West London. Alongside that, liaison services. So our Ealing liaison psychiatrist psychiatry service has been accredited by the Psychiatric Liaison Accreditation Network. Apologies, tripping over. NHS Communicate Award Trust for the innovative Mother Tongue project. So this is work by the perinatal team to reach women who aren't currently accessing the service. There is a presentation on this further in the AGM. And then just a note on a very individual level, our trust head of forensic social work, David Cochran, was awarded an MBE. And David works in high secure services and has worked in social work for over 30 years. And as I continue to get a dry mouth and stumble over my words, I will hand back to Maria so I can just take a quick cup of tea. Thank you.
I'm glad you had to read all of those out, for their complete tongue twisters, aren't they? So just a couple of slides for me before we get into the finances. So I'm looking forward, obviously the board in Cobham is new. As I say, our first meeting is tomorrow, and we will be letting all of our staff and our partners know how that develops over time, as we particularly drive the agenda around improvements across mental health and our community health services, and how we work with partners, and particularly with primary care. And that, I guess that leads us on to the question about integrated care. We are going to be looking at our services and think about how we could integrate those services better at a place level, so that they're operating at that place level in a joined up way, and particularly thinking how they align with our local authorities, voluntary sector, and indeed primary care. So that's definitely a key piece of work for us in the year ahead. We've obviously got a new government, and we have got locally, obviously we've got a new health secretary as well. We'll hear in the King's speech tomorrow some of the priorities for the health service, but we know that the new government are very keen on the preventative agenda, which I think is quite key for us in an organisation like West London. We've got some new and re-elected politicians locally. I've personally written out to all of them to congratulate them, and we'll be hopefully meeting with quite a number of those over the coming weeks to understand from them how we will work together and what they see as their priorities for their local constituents. And then finally, our trust strategy, which we can flick to the next slide for. This was refreshed last year, so I can personally take no credit for this. I was not in post, but thank you for everybody involved in pulling this together. And as you will see there, collaboration and system leadership, I think I've talked about already. Population health is a really important element for us to think about how we adapt our local services to reach all of our communities, and we break down those barriers and tackle some of the challenges around inequalities and how people access health services. Our staff are really key, and that's why that's one of our key strategic priorities. And then the final two, we really want people to work in a culture of continuous improvement and continuous learning. So we are continuing to drive our programme of quality improvement. We want our staff to continue to come up with new and innovative models, and you'll see some great examples of that later on in the AGM. And ultimately, we want to be able to be an outstanding organisation. So that's probably a good point for me to pause on while I hand over to, I think, Paul and Manpreet to just quickly take us through our accounts for last year. Thank you both.
Thanks again, Manpreet. So this is just a quick intro from me. So with my Chief Financial Officer hat on, I spent many years presenting this part of the AGM, which is always, without doubt, the highlight of any AGM, the financial position. I'm sure you'll all agree. But seeing as though I've spent quite a portion of the time holding the fort until Maria came in, I think it would be remiss of me to take credit this time round personally, and I think that credit needs to go to Manpreet and the finance team for delivering the position this year. So without further ado, what I'm going to do is hand over to Manpreet to take all the credit for it.
Thank you, Paul. Always happy to take credit for a surplus. Can we move on to the next slide, please? Okay, so we were working with income circa 51 million, which is about 23 million pounds more than last year. And with that, we were able to finish the year end or deliver a surplus of 422,000 pounds, which is just under 1%. So we did use pretty much all our money wisely and hit our plan. And this would not have been possible if we hadn't worked very hard on our financial management, but also meeting our cost improvement plan for the year. So our cost improvement plan was to meet a saving target of 11.2 million, and we actually exceeded that. We're ending the year at 11.5 million this financial year. So it's a good revenue position. Moving on to the next slide, please. So in terms of where we spent our money, when you look at the pay non-pay comparison, there's pretty much as expected 30-70 split. This is generally the standard for mental health and community health providers. It does differ from the acutes, where the split normally for non-pay is in the region of 35 to 40% because of the infrastructure costs they have. So it's as expected, pretty much in line. Not much movement on the comparison when you look at types of spend. There has been some increase on the purchase of healthcare from NHS and non-NHS bodies, and that basically relates to, we are the CAMS provider collaborative lead, so the CAMS provider collaborative commissioner. So that is us commissioning additional CAMS services with local partners and local NHS organisations to support CAMS services in North West London, alongside additional purchases we made with the third sector and local authorities to support the delivery of the mental health investment standard. So that's where that increase comes from. Sorry, can we move on to the next slide, please? Thank you. So in terms of capital, we spent almost 20 million, which doesn't seem very much when you're looking at a trust that's 450 million pounds worth. And we were working to a plan of 21. There was some slippage at the end of the year. A majority of the money was spent to finish off the work for Broadmoor, increase our space for the our health space place of safety at the Lakeside unit, enhancing our IT infrastructure and the general estates improvements we required. It was disappointing. We had some slippage at the end of the year, and therefore weren't able to spend that final million. However, there's a silver lining, because we work as part of the North West London system. Any surplus goes into the North West London system plan or a year-end position. And as a result of our contribution through capital and break even at revenue, North West London will be able to meet the financial plan for the year. And we have also, together with North West London providers and ICB, submitted a break-even plan for this financial year. And as a result of that, additional a capital resourcing limit has been made available, and of which we have been allocated 9.8 million. So that means we've got an additional 9.8 million over and above the capital allowance we would have got for 24-25, which we will be focusing on enhancing our environments and making improvements wherever we can. So that's the silver lining. Can we move on to the next slide, please? Okay, so agency expenditure. As you can see, we have had some improvement on cost reduction on agency. It's not as much as we'd have liked to have made, but this is the result of success in recruitment. And we are hoping that this success in recruitment, as it continues on as a full year effect into the new financial year that we're in now, we'll see further reductions on agency as we bolster up our bank and ensure that we maintain reduced vacancy levels. But overall, it is a reduction, and we do expect further reductions. Sorry, next slide. Thank you. So we do have a very healthy cash position, although there's been quite a movement from almost 87 million to just under 67 million. This is largely due to the final settlement we had to make or needed to make for the works that were done to build our new Broadmoor Hospital. So now that's finally done, dusted. But overall, we have started this new financial year in a very healthy cash position. Also, we will be expecting, following the sale of our old Broadmoor site, a significant cash injection for 26-27, which would be quite helpful as well. So overall, cash healthy too. So that's all the fun finance stuff. I will now hand you over to my colleagues, Dr. Chris Hilton and Dr. Claire Dillon, to tell you more about our community health services.
Thank you, Manpreet. So I am merely going to introduce this item. My name's Chris Hilton. I'm the Chief Operating Officer for our local services across the 3 boroughs of Ealing, Hammersmith and Hounslow. And we thought we would focus briefly this year on the last 10 years within West London Trust and the change in the nature of the services we've provided. So many of you will know West London as a mental health organisation, and we still remain proud to be a provider of comprehensive and specialist mental health services. However, you can see from the slide that's currently on display, over the last 10 years, we've been on a really significant journey, developing a wider range of community healthcare services and integrated care services. And this starts back in around 2013, when the Smoke-Free Ealing Public Health Service transferred into the trust alongside some of our talking therapies from the old PCT in Ealing. Shortly afterwards, West London Trust successfully bid for our first major community health contract, which was intermediate care in Ealing, and was also one of our first services that we delivered explicitly in an integrated partnership with our neighbours in CNWL. We also that year brought on a whole range of additional public health services in 1U Ealing. And we followed later in a similar partnership to Home Ward Ealing, but led by CNWL in the inner 3 London boroughs, launched the Community Independence Service, where West London Trust remains the provider of the intermediate care services in Hammersmith and Fulham. As we gradually built our experience and confidence and the scale of the community health services that we were providing in the trust, it's now 6 years since West London Mental Health NHS Trust was officially and formally renamed as West London Trust to reflect the wider nature of services that we provided. And then, among the other things that were happening around 2020, we also started to work much more deeply in collaboration with our partners across North West London, not only the acutes, but the other community trusts in what became later the North West London Community Provider Collaborative. Within that, each of the community providers took a leadership role in providing support to the acute hospitals, leading their discharge pathways, and we took responsibility for Ealing Hospital's discharge flow. And we also launched the Mary Robinson unit, which was pioneering nationally in terms of managing patients with COVID, supporting their discharge. All of this came as part of Ealing Community Partners. We launched Ealing Community Partners around that same time, and we're now in the 5th year of that 10-year contract. And in 2023, we had our first Hounslow contract awarded, which was to deliver respiratory services, respiratory nursing, and pulmonary rehab, which takes us to the start of this new year and a new time for the Trust, where we are also bringing on board colleagues who've transferred from Hounslow and Richmond Community Healthcare as a new service line, Hounslow Community Healthcare, within the Trust, and also an advert for later this week, the launch of a whole new range of public health services in Ealing. Leading much of this now is Dr. Claire Dillon. So I'm going to pass over to Claire, who'll tell you a little bit more about how this is structured.
Thanks, Chris. So evening, everyone. I'm the Director for Integrated Community Health Services. Just going to share a little bit then about how the service lines are set up. So in the centre there, you'll see the green section, which is the community health services, which sit within Chris's structures. So we've previously had a management structure within ECP and integrated care service lines, and currently Neville Cheeseman supporting as the interim clinical director. But really delighted to have welcomed Claire Miller as the deputy director for Hounslow Services, for Hounslow Community Healthcare, and as the AHP lead, and also Rosalind King, who's the Director of Primary Care Networks, and that really strengthens our relationship, thinking about the journey for patients from primary care to within the community services. On the right-hand side, we've got the forensic services, with Catherine and Rob leading West London Forensics and High Secure, and then on the left-hand side, we've got the services that sit in local services for acute, community, older people, children, and psychological medicine. So I'm going to focus in on the green area, the services within community health. If you go to the next slide, please. So the existing services are in the slightly darker blue colour in the middle. And so that included, as Chris has said, Ealing Community Partners, but also Hammersmith and Fulham Community Independent Service, and a range of local authority commissioned health services, some of which I'll talk a little bit more about on the next slide. But really excited on the 1st of July to have welcomed colleagues from HRCH. And so we now have Hounslow Community Healthcare Services and Hounslow GP Consortium with us. So there are 756 staff transferred in to join us on the 1st of July, and you'll be hearing from Lisa, who is one of them, very shortly. Next slide, please. So some of the highlights that I wanted to share really are around our partnership working, and there's been a huge amount of work with ICB colleagues, public health colleagues, and also the council. And we've had some really incredible outcomes as a result of this. So diabetes has been a focus, and trying to reach communities and populations that ordinarily wouldn't necessarily have reached out to us, and thinking about innovative ways of spreading the information around diabetes and reducing risk factors. One of the things that was done were cooking courses, which were done in conjunction with the University of West London, and cookbooks being produced. It's been translated into a number of different languages, and it's now gone out through community links, so that it's not just the people who were involved in the intervention that benefited, but their family members and their friends and communities are sharing these, and it's really lovely to see how it can be cascaded. The smoke-free service has been mentioned and is expanding this week. So previously we were supporting patients with mental health needs and maternity patients, and this is extending to a much broader offer to reach many more patients within the borough. The TB awareness service has also done something similar to the diabetes service in terms of reaching out to faith leaders and going into mosques and finding high density areas where TB is prevalent and engaging people in a different way. So not expecting people to come to health sites, but engaging people in their ordinary weekly activities around screening and signposting and enabling people to get the treatment that they need for TB. So it's been really successful. The community collaborative has been mentioned already, and we run the urgent care spa for urgent community spa for Northwest London, and that has been really positive, and lots of good feedback from colleagues in emergency services around that. We're working collaboratively across all the trusts around waiting lists, around some of the service specs, and there's been a lot of work done within community nursing and within the children's space as well. So if we move on to the next slide. Yes, some of the things have been mentioned already, but we're really excited by the expansion of community services and thinking about the patient need, the population need, and what we can do within the boroughs of Ealing and Hounslow, and also Reach in Hammersmith and Fulham. So there's much more integration that can happen. And earlier today, we were on a call with children's services, mental health services, community services, and it was already evident that the networks are forming. There's lots of innovative ideas coming to life. So that's really exciting to see. We're also keen, obviously, with our partnerships with council and the borough-based partnerships to continue the work and to really drive forward innovation in those spaces. We've mentioned staff, and we can't deliver excellent and outstanding services without an engaged workforce. And so there are lots of opportunities that we've been talking about to develop our staff, to look at career progression within our community services, and we're really excited to develop that further. So I'm going to hand over now to Lisa. So Lisa Gordon joined us on the 1st of July. So quickly, Lisa was roped in to be sharing some of the amazing work that's been going on in Hounslow. And Lisa is a specialist health visitor, and she's going to share with you some of the work around engaging asylum seekers, but also thinking about how she's embraced the challenge around inequalities. So welcome, Lisa, and over to you.
Thank you, Claire. This really is a whistle-stop tour. So yeah, as Claire said, my name's Lisa Gordon, and I'm one of the health visiting team. I've come over to join West London from HRCH. I'm just going to tell you a little bit about my role. So for those of you that don't know, health visitors support families from pregnancy up to when the child turns 5. We're nurses or midwives who have a specialist qualification in public health, and we work with a skill mix model. We're supported by community staff nurses and nursery nurses, and we have 5 mandated contacts with all families, and we see every family that moves into the borough for a family health needs assessment. We also play a key role in safeguarding when there are concerns for families with safeguarding. So just to give you a bit of background, historically we saw an influx of asylum seekers into Hounslow during the pandemic, into the empty hotels around going towards Heathrow. And instead of being moved on to new accommodation, as they had been in the past, the families got stuck in the hotels due to lockdown rules, and also due to the lack of resources from the Home Office to process claims, etc. So currently, Northwest London has more asylum seekers than any other region in the UK. Most of them are in Hounslow and in our neighbouring borough of Hillingdon. So under my sort of care, we have 150 babies and children across 3 hotels in Hounslow. At the current time, the numbers fluctuate. We're still seeing families come in on a regular basis, crossing the channel on inflatable boats. So far this year, 13,000 people have crossed the channel. And we know that it's a risky business, and sadly, people lose their lives coming to the UK. Families are coming here, leaving everything they know in the hope of a better life for themselves and for their families. They travel overland from countries such as Afghanistan, Yemen, Sudan, and Syria and they're taking many risks on their journey, from traffickers, modern slavery, women become pregnant when they're forced into sex work. So these are the families that we meet in the hotels. Babies can be born on the journey, couples are separated and by traffickers and might never see each other again. So once in the hotels, the families are provided with all their meals and essential items, plus they get a weekly living allowance of around £8.86 per person per week. There are some additional allowances for babies and children under the age of 3. So next slide, please. I started my role in November 2022, and since then, working with others, we've achieved the things that you can see on the slides. And I have to confirm that that's not just health visiting. This is it's collaborative piece of work that we work with GPs and mental health services, schools, teams in public health and the council. We also work with our local family hubs and charities that support asylum seekers. So it really is a collaborative piece of work that we do. So the families that are in the hotels, they have no access to cooking facilities. And this is a big issue for the families. Can you imagine being in a hotel for 2 years without being able to cook food for your family? So we get lots of complaints about this. We see children that are poorly nourished, that haven't, their journey to start eating food has been a poor one, and they're just having all, knock-on effects of health issues from the poor food that's provided. So this is probably our biggest challenge, and we're working as hard as we can to improve the quality of the food at the hotels. We've been lucky to have vitamins funded by our local public health team, so that's a win that we can give out to pregnant women and for the babies and children. And I think one of the key advantages of the role I'm in as a specialist health visitor is that I have a physical presence at the hotels, and people get to know me. People that are generally wary of professionals, we can build a relationship and hopefully build trust. We have access to telephone translation services, which I use for the majority of my visits. So next slide, please. So this is our wish list for the future. One thing I'm really interested in, and one thing that makes me excited about joining a trust that does a lot of work in mental health, is culturally sensitive ways of assessing maternal mood at our visits, because I'm not sure that what we're using at the moment is appropriate, really. And the cultural aspects of understanding what we mean by mental health, it's a very complex area, and I think this is something that I'd really like to work on and improve. The definitions of mental health are not really understood by lots of cultures, and there's also reluctance to engage, fear about admitting struggles and how that might affect well-being, asylum claims, etc. So just to finish, working with the families, I consider it to be a privilege, and the people that I meet are on the whole very grateful, humble people, and I do my best to show kindness and compassion, and also offer the gift of connection, which is really what some of these families just need. They need someone to connect with them, because they could really literally not know anyone else when they first arrive here. Please contact me on my email, which is on the slide, if you have any questions or you have anything that you'd like to discuss with me. Thank you for listening, and I'm now handing over to Gillian Kelly.
Thank you, Lisa. That was just amazing work to hear about. So wonderful. And there are lots of connections between what I'm going to speak about. So hi, I'm Gillian Kelly. I'm the interim chief nurse. I'm going to talk about co-production and how we involve and work together with the people who use our services and their loved ones. How long have I been muted for? The whole time? No, I'll carry on. Apologies, I just saw it muted. So just by background then, back in 2022, we undertook an independent review that was completed by Future Bright, and they looked at our service user and carer experience meetings, as well as our co-production partnership strategy. And the outcome of this was quite mixed. There were loads of examples of really great practice, as well as areas for us to improve on. One of the key highlights was the need for some dedicated central resource to help drive the work around co-production and partnerships. So in 2023, we appointed a head of involvement, co-production and partnerships. Her name's Alex Watson, and she has strategic oversight for the strategy, as well as provides advice and support. And she was instrumental in refreshing our strategy for 2023 to 2026. Next slide, thank you. So the strategic vision and principles, as Maria was saying earlier, our vision as a trust is to be an outstanding healthcare provider, but we can only achieve this by building the organisation in partnership with the people who use our services, carers, staff, and our wider communities. So we've built our strategy around that and some commonly accepted core co-production principles, which include working in equal partnership in the way that we design and deliver our services, recognising, building on and growing people's strengths, offering a wide range of opportunities, networks, chances for us to hear feedback, to learn together and to build on good practice, to start to reconfigure really the ways in which our services are developed and delivered, and to proactively reach out into our local communities, particularly to support and involve those who may experience the greatest barriers to accessing our services. So in terms of progress in delivering our strategy, I'm just going to highlight some of the achievements and things that we're doing next. So we've developed and mapped all of our service user and carer and community meeting spaces, and we launched a brand new People and Communities Partnership Forum. We've also expanded the local involvement groups that were well established in Hounslow, but they've now moved into all of our boroughs, so in Ealing and Hammersmith and Fulham as well. And we're continuing to grow our Carers Council membership and run bi-monthly carers listening events. And we learn and take the themes from those events back into the work plan that the Carers Council delivers on and drives. We've also spent some time developing our expert by experience offer for both people who use our services and their loved ones. So we've updated our involvement register and the way in which we pay people who undertake involvement work with us, and we've tried to make that easier and more accessible. We've co-designed a co-production training package together with service users and carers, and that is being piloted as we speak, so that's exciting. We've also launched a new recruitment panel training for service users and carers to just enable people to have that training and support when they're getting involved in the recruiting our staff. We've co-produced a good practice guide for staff to help them in the way that they recruit and work together with expert by experience. We've also established a peer support group for those experts by experience that are working with us. So it builds a bit of connection, a bit of an anchoring sort of place for people to come together and to share their experience of the work and to support really in that work. And we're also currently developing a new opportunity section on the public website to make it much easier for people to see where can they get involved in the work that Trust's doing. We've expanded our work with carers, so we achieved our first star for implementing the Triangle of Care back in 2020, and we're now underway for our second star, which is focusing on community services. Star 1 was around inpatient settings. And we're also implementing the patient and carer race equality framework. And I just want to spend a moment on that before I hand over. So people may be aware, but the patient and carer race equality framework is designed really to address access, experience and outcomes for racialised and culturally diverse communities in mental health services, and to really improve trust and confidence in the services. The framework's broken down into 3 different areas. So there's a component around leadership and governance. We have the executive board lead. I'm taking up that leadership role. And we have started just to think about the implementation plan and, importantly, all of our core measures and the data that sits behind this work. We have started to develop the patient and carer feedback systems, loops and data, and make improvements in that. And we're also building organisational competency. So this includes cultural awareness training, consultations with team around cultural awareness, and building on community engagement, partnership working and co-production. So just briefly then, our actual PQREF community engagement plan is just beginning. So we're right at the start of this work. We are analysing all of the community surveys and the insights and the information that we've gathered over recent months and years. And we're really just focusing on raising awareness of this framework with our patients, with carers, with our communities and staff. And then we're working with our partners across North West London to begin to align the work that's already being delivered and to not sort of duplicate things and to be sort of stronger coming together. And we're bringing together lots of different people now and groups who have knowledge, interest and lived experience. So I'm hoping we can pop it in the chat, but we've got some PQREF community listening events that are taking place over the coming weeks, and we'd love you to join those. It's open to all, to people who use our services, their loved ones, people in the community and our staff. And we really just want to build our relationships and work together to co-produce our plans going forward. So I am going to hand over now to Dr. Jamila Carey and Fahima Abdi, expert by experience, to talk a little bit about the work that they've been doing in tackling inequalities in perinatal mental health. Thank you.
Thank you so much, Gillian. Thank you, everyone, for listening to us today. We're very excited to talk about a few projects that we undertook in the Perinatal Mental Health Service. And so I'm here with my soon-to-be colleague, our super expert by experience, who is a success story and soon to become a peer support worker in our service, Fahima, who will join me for the latter part of the presentation. Next slide, please. So what is perinatal mental health and why is it important? Perinatal mental health is concerned with supporting the mental well-being of women who are planning a pregnancy, currently pregnant, and in the following 18 months after delivery. This is important because maternal stressors can negatively affect a child through a number of factors. Firstly, physiologically, during pregnancy, maternal stress can impact the environment that an unborn's developing brain is in. And environmentally, mental ill health during a child's early years can contribute to impairments in social communication, emotional regulation, and long-term mental health. So in this way, maternal health has intergenerational ramifications and directly equates to population health as a whole. Even more important is the fact that perinatal mental ill health is actually very common. Roughly 1 in 5 women have emotional and mental health issues during the perinatal period. And the highest risk of severe deterioration are those women who have a pre-existing psychotic or complex emotional need disorder. So in our service, which is a tri-borough service amongst Ealing, Hammersmith and Fulham and Hounslow, we aim to meet 10% of all birthing mothers in our area and support them to either get well or stay well. And we meet women where they are, in antenatal clinics, in children's centres and in their homes, in order to provide planning around birth, medication management, psychological and occupational therapy interventions, and group and peer support. When we analysed our caseload and compared it with census information, we really noticed that there was an access and treatment gap for certain racialised and minoritized populations. So we decided to meet with service users from different backgrounds in order to consider with them if there was a barrier or a delay in getting our support and what might have been contributing to that. The summary of the themes which emerged from those discussions are in the left-hand column of your screen. And some of the actions and initiatives to respond to them or that we've already been including in our work are on the right. So I'm going to talk particularly about the top 2 rows. We have 2 particular projects which we undertook in the last year, which address this issue of sociocultural beliefs and myths and expectations about which affect help-seeking behavior, and also about peer-to-peer relationships. So I actually started by collaborating with Imperial researchers who were doing their own piece of co-production work, looking at local communities and developing research questions with them. So the Imperial researchers had also already been working with a community leader called Katra Haji, who has, with her husband, developed a very vibrant Somali community group in Hounslow. I've met Katra a number of times. I met the researchers a number of times, met Katra with her husband and also with members of her community groups over a period of about 6 to 8 months to really learn about their experiences of motherhood and how that intersected with the statutory services which they came into contact with. And the topics raised in those discussions were what drove development of a bespoke workshop event that we undertook for Somali women in Hounslow in June of last year. So I'm going to pass on to Fahima now, who was a facilitator at the workshop, and she's going to speak of her experience.
Thank you, Jamila, and good evening, everyone. So as an expert by experience, I collaborated with clinicians from the perinatal team to appeal to the Somali community, my community. The event happened in the afternoon and ran for approximately 2 hours. Throughout the event, engagement was very lively, excuse me, and we were able to create a clearer understanding of the service and also the role of social workers. One of the defining factors of the workshop was that approximately 25 people attended and no one left during the session. We had a huge engagement in conversation, which included non-English speakers. There were many factors that made the Somali workshop successful. The workshop was held at a local mosque in Hounslow. It is a place where the Somali community come to seek counsel on marriage, financial difficulties, engage in celebrations and religious duties. This enhanced engagement as it was a familiar setting and it created a safe and open space. Having Kadra, who's an active community leader in Hounslow, at the event gave it credibility, and also we believed was the reason for such a great turnout. Having an interpreter was essential during the Q&A, as women who could not speak English or understand English asked questions and engaged with the conversation. Language was not a barrier because we had access to this resource. Having a diverse panel was very important. A Muslim social worker who wore a headscarf, women with shared or familiar backgrounds allowed many women to open up as they felt seen within the perinatal team and supporting panel. Many fears shared were of their children being taken away due to accessing mental health resources, such as the perinatal service. And through informed conversation, a clearer understanding about social services and the perinatal team was brought forward. Having myself present at the workshop, who is from the community itself, sharing my struggles with my mental health after giving birth to my second born, and explaining how I access perinatal health, the perinatal service, as well as being able to give a detailed explanation about the support groups that I attended, such as cooking groups and arts and crafts groups, also explaining the therapy process, as well as debunking a lot of myths surrounding medication and breastfeeding. Children were able to attend the mosque and be part of the workshop. Many mothers spoke about not being able to attend many events due to childcare, as well as having children with additional needs, and those being the main reasons they don't engage or come to events due to fear of judgment, children's safety, or needs not being met due to the lack of facilities. I believe an indicator of success, I felt, was that the workshop laid a lot of groundwork with the Somali community. The walls that were present at the beginning of the workshop had come down as we went along through the day. And that alone could change the lives of many women and improve their quality of life, just based on them understanding what perinatal services are, how to access the service, but mainly how getting better did not mean losing their children. During the event, many women approached the panel and shared lived experiences with mental health. Many women who did attend had small babies and were explained the many avenues to seek a referral or self-refer themselves to the perinatal service. The Q&A presented so many questions and conversations. Many women expressed that they felt this workshop needed a part 2. Thank you. Next slide.
Thanks, Fahima. So following on from Fahima's testimony, what we realized in speaking to our service users is that they often didn't feel safe to open up about their experiences of mental ill health in motherhood unless or until someone else in their circle had done so. And often these conversations were happening years after they had given birth or been struggling with mental health issues, far too late. So we as a service wanted to kickstart these conversations between women in our local communities and provide a platform for our service users to speak directly to their peers in their own words. And this was how the Mother Tongue short film project was born. So we worked with a filmmaker, to create short shareable clips, which we hoped would go viral. And we set up local screenings in centres in Ealing and Hammersmith and Fulham, and are soon to do so in Hounslow as well, and built community engagement events around these events with a panel discussion and question and answer sessions, which allowed us to widen our networking net and get to know more stakeholders and community organisers that we previously hadn't reached. So we're going to attempt to play the film trailers now.
नहीं समझ लग रही थी कि मेरे साथ क्या हो रहा है.
Niliona sina thamani kabisa, siogi wala sichani nywele.
كثيرا ما نسمع عن الأمهات يقلقن من أن ينظرن إليهن على أنهن ضعيفات جاحدات أو أمهات سيئات.
काफी मुश्किल हो सकता है किसी से मदद मांगना, खासतौर पर वो ख़वातीन जो मुख्तलिफ कल्चर की हैं.
إذا كنت غير متأكدة مما إذا كنت ستستفيدين من خدماتنا فيمكنك التحدث مع طبيبك العام في هذا، أو يمكنك أيضا إحالة نفسك مباشرة لفريقنا.
Thank you so much. So I just wanted to finish our presentation. I think we've lost the last slide, by quickly saying that we hope to deepen our relationship with the West London Somali community through undertaking direct work with imams, and in particular deepening the understanding of perinatal mental health with Somali fathers. So that's our next big project, as well as undertaking engagement work and hopefully co-producing some pathway development with our young mums and their partners. But overall, through the course of the last sort of 18 months, where our diversity work has really ramped up, we've learned that patience, persistence, and humility are really the essential building blocks when undertaking inclusion work. And there are absolutely no quick fixes, but rather health inequality is overcome one community at a time and one conversation at a time. Thank you. I think we're going on to the questions now.
We are. Thank you very much for that presentation. That was just absolutely fantastic. So really can't thank you enough. What an incredibly inspiring story. I know it's one example amongst many, but it really is really fantastic to hear about that work. It's so important, especially to reach out to a group that is considered hard to reach, but actually it's up to us to find the ways to reach out in a proactive and creative way. And I think you've really done that. And I think there's just so much to be proud of. We now have a chance for some questions. I think we're going to put questions into the chat, but we did have a couple of questions that have been asked in advance. And I wonder if Matthew Mackenzie is here on the call and whether you'd like to ask your questions, since you've already submitted them, or we can go straight into having Gillian provide the answers to your questions. Is Matthew here? If not, then Gillian, can I go straight over to you? And could you just state the question that you're going to answer that's been submitted by Matthew? Thank you.
Sure, yeah, no problem. So Matthew asked us, what is the trust focus on unpaid carers? And I think there's a number of pieces of work that we're doing, but the trust is predominantly the kind of mainstream, the strategic stream is through implementation of the Triangle of Care. We're part of the Carers Trust membership scheme and are very much committed to implementing all of the standards. So the scheme itself focuses on the partnership between professionals, the individual being cared for, and their family and friends around them. And it really sets out how we should work together to support individuals in their recovery, promoting safety and well-being. So we've received our first star, as I mentioned earlier, for the work that we've done in rolling out those standards in all of our inpatient settings. And now we're moving to our community settings. That's in mental health before we'll move on to our sort of physical health community services, where we'll take the principles forward, even though it originally was tailored for mental health. We're having our bi-monthly Carers Council, we have our listening events, and we've been working on a number of priority work streams to develop training, improve staff awareness, to have emergency planning booklets for all of our carers, to have spaces that carers can be listened to, heard, and that we can take action to improve things. And generally working with carers, including Matthew, actually, who asked this question. We've been campaigning. He's helped us with blogs. He's published books that I've co-authored aspects with him. So it's been a real delight working with Matthew in taking this work forward. I'm going to move on because I don't want to take too much of our time. He also asked us how we can focus on ethnic minority carers and in accordance with the patient carer race equality framework. I covered much of that in what I said earlier, so I won't repeat that now, but just to stress, we're in the early stages. Matthew himself runs a wonderful ethnic carers forum that we are working with him to make sure that we are a part of his forum and that his expertise and lived experience also gets translated into some of the work that we do. So I think it's work in progress, and the only way we'll have the best plan if we do that together with carers, as well as the people who use our services.
That's terrific. Thank you very much, Gillian. Did any other people have any questions? You can either put them in the chat, or if you like, you can raise your hand and just ask them directly. I don't see any hands going up. Going to give it one last check. If I've missed anyone, can someone else wave furiously? And if not, then that closes the question part. And that actually brings us to my closing remarks, which is just to say, in any event like this, it's very hard to summarize the work of so many people in a single meeting. And so inevitably, it's only a vignette of the work that the Trust does. I think there are just some tremendous things that are going on across the organization, and people have so much to be proud of. It was fantastic hearing about the different ways in which people are working and how we're making new efforts to reach our patients in different ways and to promote an inclusive organization that really works for everybody in all of the communities that we serve across West London and indeed beyond it. That's been really terrific just to get that sense of what's going on, and also to get a look to the year ahead. So what I really want to say is just an enormous thank you. I want to thank everybody who's made the time to join this evening's discussion, a huge thank you to all of our staff across the organisation for the work that they do day in, day out. And then a big thank you to all of the leaders in our trust. And leaders aren't just the people at the top of the organisation. Leadership can be shown at any level of our trust. And I think we're blessed to have so many different leaders in their different ways, contributing their fantastic work to do what really matters most, which is to provide really high quality care to the people that need it most. So there's a very big thank you. I will say a specific thank you, though, to Paul for leading the trust over the last 6 months. I want to really acknowledge his leadership during that period since Carolyn retired at the end of last year and before Maria was appointed. So a very big thank you to you, Paul, for all that you've done, and also to the whole executive team that Maria now leads, for everything that you're doing and how you'll continue to take the trust forward, both as an organisation in itself and as part of the new collaborative. And I'm looking forward to seeing many of you in person tomorrow for our first Board in Common meeting. And as a reminder for anyone who wishes to be there, our Board in Common meetings are open to the public. So you're very welcome to join us if you wish. If not, I think that brings us to a close, and I'll just say thank you and good night. Thank you very much.
Thanks. Bye.